Hello and welcome to the National Healthcare for the Homeless Council's COVID-19 Coffee Chat webinar series. I am your moderator, Regina Reed. I am policy organizer at the National Healthcare for the Homeless Council, and today we are talking about how to be a single-payer advocate during a pandemic. Since the founding of the National Healthcare for the Homeless Council, we have been committed to achieving healthcare as a human right. That is part of our mission. And we believe the best way to do this is through a single-payer Medicare-For-All system. Given the numerous challenges our community has faced in the last year, particularly the pandemic, and also the upcoming election with possibly a new president and Congress in office, our strategy and talking points for advocating for single-payer Medicare-For-All is changing as it should be. We're going to talk about that today, and I'm very excited. We have some great panelists, including Stephanie Kang from Congresswoman Jayapal's office, who will give us the rundown on what's going on Capitol Hill. We have Melinda St. Louis from Public Citizen to talk about how to take action at the state and local level. We have Max Romano, a physician at Healthcare for the Homeless in Baltimore, where I am based, and he's going to be talking about his personal experience with advocacy and share tips for clinician engagement. And then my boss, the Council's Senior Director of Policy, Barbara DiPietro, who is also a board member of Healthcare Now, will talk about how our community, the Healthcare for the Homeless community, can engage, cover new resources, and how to talk about this from our perspective and more. So I will invite my panelists to share more about themselves when they share their piece. And before we get started, we have a few questions for the audience. We want to get a feel for who is in the room. I encourage everyone to participate. Brandon, if we can get that first poll question up. And I hope our panelists will participate in this as well. We're asking, what do you find to be the most frustrating part of our healthcare system? You can check all that apply, and if there's something you don't see here, please put it in the chat. I'll give that a few seconds. It looks like the most popular answer is all of it. And coming in for a close tie to second is insurance is tied to my job, finding doctors and network. But really, we've selected everything here. All right, thank you, Brandon. We can close that. And I'll ask Brandon to open the second poll question we have for the group. And this is, how comfortable are you talking about Medicare for All and single payer? There are no wrong answers here. We want to tailor our conversation to be most valuable to you using your responses. And again, you can check as many as you want here. And I encourage our panelists to also participate if they would like. It looks like the most popular answer is comfortable talking with close family and friends. We had a good number of votes for comfortable talking to anyone and everyone. It's good to see that. All right, Brandon, thank you. You can close that. All right, I will turn it over to our first panelist, Stephanie. And before she starts, I'll say, please continue chatting with us, putting questions in. We hope this is interactive. So Stephanie, over to you.
Great. Thank you so much, Regina. I just have to highlight, how much work Regina and Barbara have both done for the Medicare for All movement. I've really enjoyed in the past couple of years working with you both side by side and all the help that you've provided our office by being able to talk about Medicare for All, especially from the unique perspective that you all bring. Hi, everyone. I'm Stephanie Kang. I am the Health Policy Advisor for Congresswoman Camilla Jayapal, who is a representative of Washington's 7th District, and she's the lead sponsor and author of the Medicare-For-All bill in the House of Representatives. I'm also currently a doctoral student in public health at the Harvard School of Public Health. And I always just start with sort of how I came into this work, and really to encourage other people who perhaps were not even, in the health policy space, to be encouraged to join in and be part of this conversation. And for me, I was very much working in global health, but when I saw really the state of our healthcare system, especially, with the backdrop of a Trump presidency, I felt compelled to get involved, and I didn't know exactly how. And luckily I was able to find a fellowship that placed me in this office to work on Medicare-For-All, and really help create and push a legislation that is the most equitable and comprehensive single-payer national health insurance program bill that has ever been introduced into the House. And so, before I talk about the details of that bill and what that exactly means, and I just want to remind everyone that every other industrialized country in the world, recognize you just cannot tie healthcare to employment. Employment is so transient, and healthcare should not be. And in order to have a thriving society, healthcare just needs to be guaranteed at all times. And simply just not a question. And I think about this a lot, especially during COVID, because even when we see other industrialized countries around the world that have a right-wing conservative federal government, whether it's the UK or Australia, when it comes to health care, it's just not a political matter. They understand there has to be a public, government-provided, guaranteed national insurance. Yet, obviously in the United States, we've been having this conversation for a really long time. I know Medicare-For-All itself, has been on the radar in the last several years or few years, but when we talk about either universal health care or an actual single-payer program, we've been talking about that for almost a century, even all the way back into the early 1900s, 1940s with President Truman. So I just want to make sure everyone knows this is not a new, novel, radical idea. This is an idea that has persisted over decades and will continue to persist if our healthcare system continues the way it is and doesn't guarantee everyone coverage. And so obviously, we're all facing and all have been impacted by the public health crisis that is the COVID-19 pandemic. Obviously, I think everyone has seen the headlines that it's already taken more than 200,000 people's lives. Millions of people have lost their insurance because they lost their jobs and were still unable to find another insurance plan that they would be able to replace it, right? And so all of these things are happening in this country. The scale of the number of deaths, the scale of the number of cases are happening in the U.S. while they're not happening in other single-payer countries like Canada and Australia and Taiwan and South Korea. We have anywhere from 10 to 200 times more cases or deaths per capita, right? I know a lot of people like to say, well, the U.S. has a lot more people, but even on the per capita rate, we really have fallen behind, and we still don't even have, a national testing strategy. We still don't have a national contact tracing strategy. Everything has been so fragmented, and the reason why I bring this all up, even though it sounds like a public health issue, is that it's completely related to single payer and having a single payer legislation. And even last week, I think 2 weeks ago, in Canada, there was a press conference I had seen where the Minister of Health was asked by a reporter, how come Canada has done so much better at breaking the curve than the U.S.? And it was a very simple answer. He said, because we have a single payer system. The concerns the U.S. has in terms of covering people and actually being able to have a population that is able to access care when they need it, it just changed the game completely. It's a fundamental difference. And so when we talk about Medicare-For-All, we have to be very clear about what we're talking about. Especially in the over the 2020 Democratic presidential primary, the term Medicare-For-All kind of got thrown all over the place. And some people even changed it to say Medicare-For-All who want it, or and Medicare-For-All sort of became this catch-all. But I just want to make it very clear that it actually represents a very specific legislation that has been introduced both into the House and into the Senate. And so, of course, everyone's very familiar with Senator Bernie Sanders, who ran on Medicare for All in 2016 and then introduced legislation that outlined a single-payer national health insurance system. So one, public entity that finances a health insurance system for all residents in the U.S. And this insurance package would provide comprehensive benefits. So we're not just talking about, medical care or hospital care. We're talking about the spectrum of healthcare that people need to have a dignified life. We're talking about mental health. We're talking about reproductive health. We're talking about long-term care, dental, vision, hearing, all of the above. And so the bill that Senator Sanders introduced was definitely a great start. But Representative Jayapal, when she became she started the Medicare for All caucus, and also she's the co-chair of the Congressional Progressive Caucus, which is the largest, basically, club of Congress members in the House. She decided that she wanted to have a battle-ready plan because she knew the opposition out there was going to be ready to tear it apart. They're looking to, say that this isn't going to work. So we created a very comprehensive, detailed bill that talks about not only this insurance system, but also about how we're going to finance hospitals. This is something we've talked a lot about during COVID-19 because in the midst of a pandemic, we're seeing that some of our most critical hospitals and public hospitals are shutting down, right? That doesn't make any sense. That's not happening in other countries, in other countries with single-payer systems. Single-payer system means that hospital is going to have a guaranteed revenue so that they can operate not only during a pandemic, but, throughout the time because everyone always needs healthcare. And so also we talk about drug pricing negotiation. Medicare and Medicaid are the largest purchaser of drugs in the world. It's crazy. And they're not allowed, Medicare is not allowed to negotiate drug prices. It's insane. And so this bill also makes sure that Medicare is allowed to negotiate drug prices across all drugs and is able to back that up by saying that if, pharma company, if you're not going to negotiate with us, we're going to open up your patent and allow genetic competitors to come in. And so, when we talk about Medicare for All, it's important to be really specific and think about all the different ways that our healthcare system has failed us. And, through that poll that Regina posted, we're seeing that this isn't just a singular issue. This isn't just about accessing care sometimes. It's not just about cost. It's not just about coverage, but really about transforming our healthcare system to be one that is equitable. So when we talk about equity, we're not just saying people should get some insurance, right? It's incredible. Sometimes I hear people say things like, they have Medicaid, that's good enough, or they have this type of insurance. But we're seeing over and over again, even employer plans, 25% of them, employer plans are considered underinsured. And so, when we're thinking about Medicare for All, the case has been made clearer and clearer and clearer. But I think a lot of times I've been hearing people question and ask me, well, what does that mean in face of this upcoming election, and also because of the pandemic? And like I said, I think the pandemic has made the point super clear that the healthcare system isn't working. And also the other point that's been made very clear is that no progress on healthcare is possible with Trump in the White House. And so, while I understand, of course, the, Vice President Biden, he campaigned on a public option. He actually, pretty actively campaigned against Medicare for All. But, over the last several months, Congresswoman Jayapal, along with other Senator Sanders selected representatives, were able to come together and create this task force. And through that task force, we saw that there are ways to push the potential Biden administration towards a universal health care system that is more equitable, that provides the coverage that we need, and that's going to bring down costs. And so, while it's just very clear that what the potential Biden administration has laid out so far is simply not enough, right? It's still not universal. Not everyone is covered. It's still not equitable. So, when we talk about that, we're saying anyone, and we mean anyone, regardless of age or race or zip code or immigration status or employment status or gender identity, et cetera, sexual orientation, doesn't matter. you're going to get the same level of high quality, comprehensive benefits that you need. And you're going to make sure that there's no financial barrier, right? There's no financial barrier to seeking that care, and that all doctors will be in network. I've been trying to, coordinate care for my father, and I just called 6 doctors whose website said they took the insurance carrier for my father, and all 6 of them said, oh, actually, we don't do that anymore. We don't take them anymore. It's an incredibly frustrating experience, and it shouldn't happen. Networks like that shouldn't exist. You should be able to go to the doctor that you need. And so having that in mind, I've been really encouraged by the conversation I've been seeing on the Hill. There are so many competing priorities at this moment, right? It feels like we're sort of under attack from all sides. And it's really hard to know where to direct your attention. But even in the midst of all of these competing priorities, I have seen a renewed and energized interest in Medicare for All. It's been very interesting. I mean, even in the midst of all of these things that are happening, I've seen Congress members who, supported the policy in theory but never were strong champions, wanting to be more engaged in either Medicare for All caucus activities or learning more about the bill or being able to speak on the bill than ever before. And so it's been really encouraging to see that, even, in the face of everything that was going on, even with, knowing that, a Biden administration would be perhaps resistant to a type of Medicare for All system, but to see Congress members still wanting to engage in that conversation, and seeing that we've been able to move Biden already more to the left is really, again, encouraging, and I think lays out what next year hopefully looks like should the presidency change. But we all know the next several weeks will be really crazy. And so I just want to wrap up by saying, what can all of you do, right? Me as a Capitol Hill staffer, what am I looking for from advocates and people like you? Well, first, I hope that you'll go on congress.gov, you'll check out HR 1384, which is the Medicare for All Act, and you'll go to the co-sponsor link and you'll see whether or not your representative is on that list. We have 119 co-sponsors. Is your member one of them? And if they're not, especially for all of you and the expertise that you have, you can provide such a compelling argument and discussion with those members or the staff members who perhaps aren't there yet. If your member is already on, let them know that you're thankful for it, that you're glad you have a member that recognizes the gravity of the healthcare problem. Because let me be very clear, the opposition is powerful. They're well organized, they're well funded, and they're able to pour hundreds of millions of dollars into attack ads and misinformation ads against Medicare for All. And in order to combat that, we have to make sure that the Medicare for All movement, one, is expanded and includes everyone as much as possible, but that we're making sure that experts like you are part of that conversation and able to tell and explain why we need Medicare for All in a compelling way. And so I would definitely encourage you to look up resources. I know Melinda is going to share some, and she has some wonderful toolkits and resources to be able to talk about Medicare for All. Health policy is complicated, and the nuances are complicated. And we've been able to promote Medicare for All so much in the House that now the conversations and questions that Congress members have are quite nuanced, and they're quite detailed, and are very specific parts of the bill. And so as much as you can to educate yourself about what exactly is Medicare for All, don't let them say, oh, the public doesn't really understand what Medicare for All means. No, we're going to have an army of advocates who know exactly what it stands for and is going to be able to say that in a compelling way. But the last thing I'll say is that if you feel comfortable, share your personal story about why this matters. Almost every single person I know either knows someone or has personally experienced some sort of catastrophe at different levels with the healthcare system. And a lot of times people don't even realize that a lot of the interactions we have with our healthcare system are completely unnecessary, and we should not get used to that status quo. And so if you feel comfortable being able to share that, of course, expertise is always nice, but we want to make sure that we share those stories, because when you do that, you're able to provide a solid example as to why these other half measures simply don't work, right? People say, well, why don't we just pass whatever is easiest? No, we have to get at the heart of the problem, and those stories capture that. And so I'm really, really excited for this conversation that we're going to have. We have a lot of other great speakers who are going to provide different perspectives. But, just want to let you know, please, please, please never hesitate to reach out to your office. I know it seems like, does anyone actually read those emails or listen to our voicemails if we call our member's office? They actually do. Every staff meeting, we get a report out of how many times people asked for X, Y, and Z, and what is seemingly important to our constituents. And especially in COVID-19, y'all have Hill staffers captive. We are constantly tied to our phone and email. So take advantage of that. October recess is coming up, and so Hill staffers have a little more room to breathe and a little more time to actually respond to emails and voicemails. So call your Congress member, ask them about their position on Medicare-For-All, encourage them to sign on or be greater champions for Medicare-For-All, and just please exercise and take advantage of the expertise and ability that all of you, privilege, quite frankly, that all of us have to be able to talk about this issue.
Thank you so much, Stephanie. It is so great to hear from you straight from the source, and we're so appreciative of all your work on the Hill and your generous partnership with us and for being here today. Great tips for advocates. I know that organizations like the Council, like Public Citizen, we have the tools and resources and talking points to make all those suggestions Stephanie made very easy. We have Dr. Romano here to talk about how he incorporates advocacy into his work. So we're here to make it easy for you. And with that said, I will turn it next to Melinda from Public Citizen, who is one of our national partners helping to lead this movement for Medicare-For-All.
Thank you. It's great to be here with you. I'm just going to share my screen really quickly. Give me a second. Let me get to, slideshow. Beginning. Okay. Can everyone see that? Can you see that? Just want to make sure it's working. Great.
Yes.
I work really closely with Stephanie. It's wonderful to share the panel with Stephanie, and I really want to thank National Healthcare for the Homeless Coalition for inviting me. I really appreciate your partnership in all of our work, our collective work to win Medicare-For-All. They asked me to speak kind of on the how side of what should we be doing right now, and what are ways that we can plug in as activists, as advocates, in this fight. And so I want to touch briefly on advocacy with your U.S. representative and senators. I think Stephanie did a great job with that already. And then I really want to focus on a campaign that we have built out an infrastructure for to win local municipal resolutions in support of Medicare-For-All as part of our really grassroots power building effort to win this, and to touch some on what are some of the strategies that we can use during these unprecedented COVID times, where a lot of our advocacy toolkit has been kind of taken off the table due to distancing, and kind of thinking through what are some creative actions and visibility efforts that people have been taking. So I won't go much into this because I think Stephanie already did so extremely well. But we're in the middle of an absolute catastrophe, and with the COVID-19 pandemic, and yet that is going to be an opportunity for us to really make some of these arguments and actually flip some of the fence-sitting members of Congress. I really believe this strongly. I mean, we were, when you look at the political context, there, one thing happened in the primary, and so again, there's in terms of the candidate for president, where we are in terms of Medicare for All is in one place, but the COVID-19 pandemic kind of threw everything on its head. We still have financial barriers for people to get treatment for COVID-19, despite the CARES Act, despite all of these things. We're seeing examples of $10,000 bills that people have gotten for getting testing and treatment, fighting with their insurance companies. Some of the insurance companies have been waiving, saying that they're waiving cost sharing, but then putting premature deadlines on those waivers. And it's just really confusing. Our system is confusing. It makes it extremely difficult for us to be able to respond to COVID the way we need to. And obviously, the disaster of tying healthcare into employment has just become crystal clear, I think, across the board, even for people who have felt like, well, this isn't something I have to worry about because I have insurance. I think everyone understands just how precarious the good insurance that we may feel like we have is. And then, of course, the fragmented nature of our system made it that much more difficult to track the spread of coronavirus, provide the equipment where it's needed, when it's needed, because all of that is driven by profit instead of by what is needed. And so I think this is the moment when we have to really mobilize because the stakes are just absolutely too high. So mentioning again the HR 1384 and S 1129 in the Senate, those are the bills that we are advocating for strongly. And I just want to reiterate that all representatives and senators need to hear from their constituents on this. Our main focus is with Democratic representatives and senators who have not yet co-sponsored the bill. I have the list of co-sponsors here. I think that's also in the resources. Really look and see where if your representative is on. And if they're on, please thank them and thank them publicly, because as Stephanie said, the pressure right now, and it's not just from industry and it's not just from Republicans, to stand down on Medicare for All is really strong. And but industry is spending millions. Public Citizen looked at the amount or the number of lobbyists that were being employed to lobby around Medicare for All. That went up 9-fold between 2018 and 2019. Because the industry was just starting to invest enormous amount of resources to fight Medicare for All, because we've been so successful in changing the narrative. And so they're fighting it. We have to really ramp up our champions. And then we need to really use the fact that the COVID-19 pandemic has changed the facts on the ground. Now we know. Many of us knew for decades, but even those who were skeptical before have to come around now. This system is not working, and so it's an opportunity to give some of these fence-sitting members of Congress, a run for their money. So I want to really encourage that, and want to talk a little bit later about kind of what are some of the strategies we're using. The next thing I really did want to focus, and they asked me to talk about what can we do locally, because this is federal legislation. This is something that's going to happen at the federal level. But what can we do to build the movement in our community? And I just want to mention, just on Wednesday, just 2 days ago, we hosted, with the co-sponsorship of National Healthcare for the Homeless Coalition, a very large town hall, a virtual town hall with Senator Sanders, Representative Jayapal, Representative Presley, and giants in our movement, from Dr. Abdul Syed to Reverend Dr. William Barber from the Poor People's Campaign, Adi Barkin, Sarah Nelson from the Flight Attendants Union, to really focus on what we can do that this is, again, a crossroads movement, and we need to build from the ground up. We will not beat the millions of dollars that are being, tens of millions of dollars that are being thrown into stop change, but we can build people power. So we developed a strategy to pass local resolutions at the county and municipal level, based on a strategy from several years ago with folks that were working on money and politics issues after the Supreme Court decision to overturn Citizens United, the Citizens United Supreme Court decision, and the need to pass an amendment to overturn that. That was a very esoteric issue. Most people weren't tracking it. But so there was a really strong effort, public citizen and many partners, to pass local resolutions to try to shift the national narrative. And now more than 800 of those resolutions have passed. And it really did. That was something that was not really being talked about at the highest levels, and it bubbled up until this past Congress. H.R. 1, the first bill coming out of the House of Representatives by the leadership, was about this issue. It was about money and politics, and it was about overturning Citizens United. I mean, we have a long way to go to get there, but this is the way that we were able to shape the narrative, and we want to do that with Medicare-For-All. And in a lot of ways, we feel like this is easier because, again, this is something that touches everybody, deeply and personally. And so these local resolutions are an opportunity to get local education and earned media because it's something happening locally. It brings local government officials into our advocacy with Congress, so for them to hear from city councils or know that all of the counties that they represent have passed resolutions, that makes it much more difficult for them to stay on the sidelines. And it's relevant in red, blue, and purple districts. Even if you have a Republican member of Congress who is going to be hostile to this policy until we really change the national narrative, we can work locally to build that through the local councils. And it's really important for local governments because Medicare-For-All would increase the well-being of their residents, and they are the closest. Like, they're the level of government or dealing with people who are losing their insurance, who have to go to the safety net hospitals, who are going to emergency rooms because they don't have insurance. And then local governments are struggling so much with fiscal burdens. They're not able to invest in communities because because of the skyrocketing cost of health insurance, private health insurance for municipal employees. We've been looking, and it's actually a huge percentage of the budgets of school boards, of municipal governments, is because of skyrocketing health insurance premiums. So there's a huge incentive for them to support this. And local entrepreneurs and businesses are struggling to provide health insurance to their employees, and it would improve their competitiveness long term. So these are reasons why we're finding that actually city councils are really coming on board and are interested in supporting Medicare-For-All. There's a website that's in the chat or in the resources section, Medicare-For-All resolutions, Medicare-For-All resolutions. We have a map. There currently, this says 300. We have more than 340, I think, 350 resolutions efforts underway around the country. We want to fill up this map with dots. And we have 45 resolutions have passed, and actually, we're finding during the pandemic, more and more have passed. We recently we had one pass this week, another county in in Michigan, but in New Jersey recently, St. Paul, Minnesota, New Orleans, Louisiana, South Bend, Indiana, Knoxville, Tennessee. So we're finding that this is something that's resonating even in places where you wouldn't expect. I mean, we have San Francisco and Los Angeles and Philadelphia, and so big cities, but it's really important to show these small towns too, like Holderness, New Hampshire, and New London, Connecticut. We're really finding that this is something that's resonating, and there's a really exciting way to get involved. What's great about it is we have a lot of organizational partners that are part of this, and so we can actually help to connect with people from these other organizations that are in your community to be involved and to get one of these resolutions going. I will just note that on the website, the Medicare-For-All resolutions, we have a really comprehensive toolkit that has that walks you through how to do it, that has sample letters for to your council member, that sample press releases, ways to go about this in a really step-by-step way, real specific talking points for during COVID, specific resolution language that you can pull and talk to them about. And we really want to work with people one-on-one. If people sign up on that website in your community, adding it, or we can connect you with people who are already working on it, or connect people to you if you want to get one started. So I really encourage folks to think about doing this. Like I said, at our town hall, it was super exciting. We had council members from all over the country talking about this. And I encourage folks to look at that. It's a healthjusticetownhall.org. It was just extraordinarily powerful evening, and can give you some more of those tools to get engaged. And I'll just mention again, during COVID, obviously it's harder for us to gather in person. It's not safe for us to do that. It makes it difficult, but we can generate constituent calls and emails to offices. So I'm talking about our federal electeds as well as our local electeds. And we have found that actually requesting in-district meetings via Zoom for a group of constituents is a way to bring in more people that you wouldn't be able to get to, like, go to Washington to meet with a representative, and it's sometimes a little bit harder for them to shirk the meeting, to say, we'll do it any time, and we'll just do it, at your convenience. So to really push for those meetings in district, and getting a local coalition, getting nurses involved, getting local business people. We have a business coalition that's part of this now, so we can really bring in different constituencies, labor unions, etc. And submitting letters to the editor to local papers is something that you can do, during these times of social distancing. Urging your member of Congress to co-sponsor, or thanking them publicly for co-sponsoring, encouraging the city council to move a resolution if they're dragging their feet. And we have at that website, Medicare-For-All resolutions.org, we have sample talking points for letters to the editor and tips on how to do that during COVID. So that I really encourage folks to do that. And as Stephanie mentioned, storytelling is absolutely key. All of the data, all the statistics are important. But what moves people are our personal stories, and so social media is an important way to elevate. We have a lot of content on our Public Citizen, Facebook and Twitter that you can elevate, but put those stories out, and your consumers I'm sure, have really important stories that, to tell for us to really bring these, the struggles that we're facing under this pandemic and the catastrophe that we've been living for a long time. And then there have been some really creative ideas, car caravans, socially distanced sign holding that you can do outside of the district offices, and the National Nurses United, Medicare-For-All.org, they had some tools of ways to engage in doing some of these socially distant advocacy tactics as well, when our text banking, when our calling isn't making a difference. We still want to be creating these visibility active actions, and so I encourage folks to think through that. We'd be happy. I'll drop my contact information in the chat as well. Please contact me. These are some additional resources, and thank you so much. Let me see how I stop sharing my screen. Stop sharing. Okay.
Thank you, Melinda. I'm glad to have you as a partner in this work and sharing those great action opportunities here. Now we're going to pivot to talk about healthcare for the homeless community specifically, and our piece in this, especially for a clinician. And I will pass it to Dr. Max Romano.
Hello, thank you so much for having me. It's been such a privilege. I really appreciate being invited to share sort of the clinician perspective with all of you as both a frontline worker in healthcare for the homeless program and as an advocate for single payer. So I'm a family physician here at Healthcare for the Homeless in Baltimore, and my engagement with this issue as a single payer advocate goes way back. To be honest, my mother is a diehard single payer fan. I was raised by her to think passionately about this issue. She's a physician. She was a Navy physician, works in academia in the private sector, And I think she saw from a long time ago how our healthcare system simply wasn't serving the needs of patients and how there could be something better. And so I sort of came by this honestly. I've been doing it for a long time. But eventually decided to go into medicine myself, and probably like many of the people on this call, I didn't go into medicine because I thought it was done perfectly, but I thought perhaps we could do something to make it better, and I could be a part of that. So, I had the privilege of training in both family medicine and general preventive medicine and public health here in Baltimore, and I always knew that single payer was important, but I also had a sense that you need to follow the money to understand how healthcare works and if you want to make change. So I took the opportunity to work with a number of different insurance companies, private Medicaid, managed care organizations during my preventive medicine residency, really try to get the inside perspective. And in the end, I left concluding that really insurance companies have very little to contribute in terms of improving the health of individuals and in the clinical care of their members. So, care providers, the clinicians, the social workers, the community advocates, the people affected by homelessness, these are the people that can improve people's health. Private insurance companies that are tasked with turning profits by denying care are really poorly positioned to improve health care for people in this country. So, I'm probably preaching to the choir. Based on the survey responses at the beginning, I got the sense that there's a number of people that already feel like they know enough about single payer to advocate for this, and I'm guessing there are people who work in healthcare for the homeless sites and with people affected by homelessness across the country. So I think you guys see the impact of our broken insurance system every day, just like I do in the lives of my patients. It's obvious to me that the insurance system that we have today doesn't serve people with private insurance, it doesn't serve people with public insurance, and it certainly doesn't serve people with no insurance. And there's three groups that we see all the time. So for the people without insurance, here in Maryland, where I work, we're a Medicaid expansion state. For the majority of uninsured people that I see are undocumented, and there's so many stories. Here in the era of COVID, I have patients who I've diagnosed with COVID-19, and they don't want to go to the hospital, even though they're elderly and have comorbidities, all sorts of medical problems, because they don't know what kind of medical bills they're just going to get. And I'm, negotiating with them on the phone, begging them to go, so that with the hope that my organization will back me up in paying for medical bills if they get stuck with something, a bill for care they're seeking. I have another patient who has cancer. She had a tumor removed from her jaw in her home country before immigrating to the United States. Now, years later, it's come back. It's been months and months and months as I'm trying to help her navigate, this purported charity care system that, exists. But for various reasons, this is a system that claims to be beneficent, but it's really simply inadequate for the scope of the problem. What we need is a public insurance program that covers everybody and leaves nobody out. Not to mention the fact that she's terrified of participating in a program that might jeopardize her chances of citizenship in the future. In terms of people with Medicaid insurance, we live in a Medicaid expansion state, so I'm very grateful for Medicaid expansion, but obviously, like most states, Medicaid is operated privately in Maryland by private managed care organizations, and they are private insurance companies that have the same incentives as any other private insurance company. So, I have a patient with, HIV, hepatitis, cirrhosis, substance use, and cancer. And the poor thing, she can't stay out of the hospital long enough for me to process the paperwork through her insurance company for her to see a specialist so that she doesn't go right back to the hospital. She needs cancer care, she needs, treatment for her critical anemia, and she just keeps going back to the hospital before I can fill out these forms in triplicate on paper and fax them to her insurance company, get approval to navigate this network of private insurance as well as private care provision systems. And she just keeps going to one hospital who discharge her, send her to the next, to send her to the next. So, people in Medicaid aren't served well, not besides the fact that they're constantly getting kicked out of Medicaid, having to reapply. And I think that's one of the really crucial aspects of a Medicare-For-All system that includes everybody. It doesn't make them constantly reapply or re-justify why they have insurance. And then for those with employer-sponsored private insurance, we purportedly have an employer-sponsored private insurance company in the insurance system in this country that's supposed to be the bedrock of our system, besides the fact that our government is already paying for most of health care in this country. It's not the private sector, it's not the employers that are paying for it. It's our public sector, it's taxpayers already paying for the majority of health care in this country. And I mean, we have to look no further than the COVID-19 pandemic to see how many people in the last 6 months have lost their job and suddenly lost their means for paying for a roof over their head, facing homelessness or experiencing homelessness, and then to add to that burden, they're also losing their insurance. It's just incredible, and I think, over the last 6 months, obviously, for all of us, have been incredibly rough. But I fear the next 6 months and what comes after that as we really deal with the homelessness surge that's just building, the waves of evictions and uninsurance that's coming in the moments to come. So, like other doctors, other people working in this space, it doesn't take much for me to get to complaining about all the broken pieces. But what's incredible about today and the invitation to share and getting to hear people from Representative Jayapal's office and Public Citizen, Healthcare for the Homeless Council, is that, these are the people making change. So I just want to put in a brief plug for how you, as whether you're a clinician or a person experiencing homelessness or a person working in a Healthcare for the Homeless site, can participate in advocacy. I think of it in different buckets. There is, working with a local single-payer group, finding other people working on single-payer and lending in your voice. And they want to hear your perspective, whether you're a clinician or you're a person working with people experiencing homelessness, you're a person who's facing the challenges of our insurance system, or you're a person experiencing homelessness. They want to hear from you. I've been involved with local grassroots groups here in Maryland. Melinda talked about getting in touch with groups working on local resolutions. I'm sure she'd be able to help you get in contact with a local organization doing the single-payer work, writing op-eds for local papers. They're desperate for material, and people love hearing from you, and you'll get lots of feedback and get connecting with folks. Another way besides working with single-payer groups is working with professional groups. For me, I'm a physician, so that means working through my professional societies, thinking about where's my base of power and how can I exert influence with them. So speaking loudly in support of single-payer with, in my case, the American Academy of Family Physicians, American College of Preventive Medicine, other organizations that you're professionally involved with. Even if you're not able to convince your professional society, I'm a physician. I'm surrounded by a lot of really conservative people resistant to change, and physicians have long been opponents of single-payer in this country, unfortunately. But even by speaking loudly and letting them know, you'll let other people come out of the woodwork who share your views, and you'll make the people who oppose you actually really deeply reconsider. And then the other piece is, thinking about parallel efforts and struggles going on right now. So, I think Stephanie mentioned competing interests going right now. There's a lot demanding your attention, but really these are concordant and parallel interests. Racism is a healthcare issue. Single payer is a solution to at least parts of the systemic racism in our healthcare system. We talked about the concordance between single payer and the COVID-19 pandemic. Whether this means for you supporting unions in local organizing struggles, whether it means supporting Medicare in its current form, supporting Medicaid expansion, protecting the Affordable Care Act, supporting organizations like National Healthcare for the Homeless Council or Public Citizen, and working with elected officials. Certainly if you live in a district where your senator, Democratic senator or representative is not yet a co-sponsor, they want to hear from you. They need to hear from you directly. But even in other areas, being in touch with elected officials to tell them that you support them. And then talking with everybody, your family, your friends, letting them know that you, from your perspective, care about this and you believe in this. You don't have to be an expert. All you need to do is know what you know about our healthcare system and speak honestly from that. So, and the last thing, just to say, figure out what's fun, figure out what's doable for you. Remember that activism should give you energy. It's not supposed to sap your energy, and it's not just about achieving the goal. It's about every step along the way and the minds and hearts you win along the way. So, speak loudly from your mind, from your perspective, and in the truth that you need to speak to. Thank you so much.
Thank you so much, Max. It's great to hear from you. The good news is we have so much good content to cover, and the bad news is we don't have enough time. And thank you, Michael, for your question for Max about how he talks about Medicaid expansion, which is a good thing to happen here in Maryland, is still not sufficient for your clients, keeping in mind that a lot of clinicians might be working with folks that don't have the benefit of Medicaid expansion. So Max, if you have time to address that in the chat, that's great and engage there. With that, I will turn it over to Barbara.
Thank you very much. I really appreciate it. I know we just have a few minutes, and so I'll just hit a few highlights because I don't want to go over ground that my colleagues have covered. But when we just think about the unique healthcare for the homeless perspective in the Medicare-For-All pursuit, really thinking about how does this type of healthcare system and financing system help prevent and end homelessness by promoting economic stability. It prevents poor health from causing poverty. It is more incentives to address the social determinants of health, and it facilitates a common interest in the outcomes that we're all trying to achieve. When we think about how it would benefit us as nonprofit community employers, it's very clear is that having a single-payer system would allow us to better focus on our mission and have our staff be focused on workforce development in a healthcare space in terms of delivering services. But right now, many of us in the nonprofit space have got specific staff in our human resources department only focused on open enrollment and health insurance and all of that. And how could those positions be better suited for helping us just deliver our core mission? So really interested in kind of making us more efficient employers there. And then frankly, with the money that we could save throughout the system, we can invest more into pay raises rather than offsetting the increasing cost of insurance plans. So many of us are probably familiar with that. You didn't get a raise because your health insurance went up, and so the company tried to cover that to mitigate that rolling back on you. But ultimately, that doesn't benefit us, and you ultimately didn't gain anything. When we think about how Medicare-For-All would benefit patients experiencing homelessness, really it prioritizes health. It doesn't prioritize the ability to pay, and I think that's a key piece. It allows us to focus on access to care, not on the logistics of coverage. And I think that's a very important piece that Max spoke to quite eloquently as a physician, how he's diverted into these coverage issues rather than focusing his profession on delivering care. We obviously would have an increase in choice of providers because you wouldn't have these kinds of providers taking some insurance but not others. And then I think we would just facilitate a greater trust in healthcare. And right now, I think trust in our system is a really something that's very important to emphasize. And when we think about, again, coming back to, again, Max is a great example of how it would benefit clinical providers. It liberates clinical decision-making so that Max isn't focused on what the plan covers, but rather what the patient needs. Thinking about quality in patient care, not paperwork. Thinking about how we have faster information to health information through a unified system and not splicing the data, the patient data across a dozen different systems in a community, and none of them, of course, talk to one another. And then finally, redirecting all those administrative costs into direct care. And then finally, just as a last point, Medicare-For-All is the right thing to do, and it benefits everyone. And so I think we've talked a lot about that today, but creating a level playing field, rectifying disparities, particularly geographic disparities, racial and ethnic disparities in our outcomes, how we allows us to focus on public health, greater system responsiveness, and just, again, coming back to fundamental American values of fairness and access to basic needs. We really would like to see this reducing incarceration, making communities safer, and then just recognizing that all people need care. And so this is just designed to give you some talking points as you are talking with different folks in your community, policymakers or friends and family. That's the kind of just talking points and a framework to be able to use. We know, of course, now in COVID-19, we've talked a little bit in this space about how that has refocused our attention on the flaws and gaps, significant gaps in our healthcare system. So a single payer allowing us to better respond in a COVID environment when we do have public health pandemics like this, creating a better public health surveillance system, greater efficiencies that we realize from better stability in the system. We come back to combating disparities and the focus on prevention of poor health, the poverty and homelessness, and that cycle that's all too familiar to us in the healthcare for the homeless space. Finally, I want to just talk about a new resource that we have, which is a comparative analysis paper. You can find this as a resource that's linked in our resource box, but really looking at how other countries have responded. And Stephanie spoke to this also earlier, as other countries are doing much better in their response than we are. In spite of the incredible amount of money we put into our system, we don't get our money's worth out of this. So it's really important that we be able to put the context of what we're seeing into the context of what other people have and what we could have if we move our system forward. And so finally, I know we're coming down to our last few minutes, but just want to reemphasize, we've talked a lot about action steps you can do. I think these steps mirror that. We've got the 3 resources. We've got a statement, a COVID-specific statement, and then, of course, we've got our international comparison papers. If you use this, this gives you some talking points for framing this if you're not comfortable, or it might give you some resources you can share with others. But again, being part of this conversation, continuing to talk about single payer and the benefits of it, and speaking from your heart and your experience, and rooting this in the values of what our healthcare system should be. So I can't emphasize more talking with your congressional representatives about why they should be on supporting single payer, or giving them props for having signed on. So I want to turn it back over to Regina at this point, but really appreciate everybody being here today. I think this is a broad, cross-cutting issue that a lot of us are finding space to find where our unique discussion points are in this. But overall, this is a nationwide movement that we all need to be a part of. So I'm excited to be here today with my colleagues. And Regina, I'll turn it back to you.
Thank you, Barbara. And we've linked, it looks like, all of those resources you see on this slide here in the resources tab. We are so short on time, so I just want to point out, Max, thank you for answering Michael's question in the chat about how you talk about the restrictions within Medicaid expansion and how that's not sufficient. I want to pivot that in a question for Stephanie for when we're advocating on Capitol Hill. Employment-tied insurance is such an important issue. It's a problem. We know that. I'm wondering, are you hearing enough from us about the issues with Medicaid expansion and how that's not enough with people who are not able to get insurance? And what can we do to continue to advocate on that point that's so critical for our community?
Sure. I think that this is such an important point because I don't think that there is enough conversation about the uninsured, and also even when you do have insurance, what it means to be underinsured, and then also how, one, even, like Dr. Romana mentioned that if you have a state that expanded Medicaid, there are still issues, and then in Medicaid too is just not a permanent plan that somebody has. If they happen to gain a little more income, that can disqualify them. If something changes within their household, that can disqualify them. And each state just has varying degrees of benefits and coverage, et cetera. So really, I think that what we have to remember is that a lot of Congress members probably never have been uninsured. They probably never had to be on Medicaid. They might not have had. And so the more that that National Healthcare for the Homeless can bring that unique perspective and echo that and make sure that case is really clear is really important.
Thank you. Thank you so much, Stephanie. That's good to know. We have all the resources and materials here for advocates to do this work. Please stay engaged with us. I will close out with a quick lightning round last word from panelists, and I will start with Max.
Okay, didn't expect that. What can I say? Start local. That's my advice always, is reach out to people working in your community, and if you don't know who's working in your community, reach out to one of these national groups like Public Citizen or National Healthcare for the Homeless Council, Physicians for National Health Program. They'll connect you with the people in your community because they want to hear what you have to say, because your perspective matters tremendously. And unfortunately, like Stephanie said, in many, if not most cases, our elected representatives are distant from our experience as people who work in the healthcare for the homeless space, and yet they are hired to serve our clients and make their lives better. So it's their job to help us do our jobs every day. Thanks.
Thank you so much. Glad to have you and all other clinicians and frontline workers join this work. Melinda?
Yes, well, thank you again for having me here. I just dropped into the chat a link following up on what Dr. Romano said about starting local. We have a map there so you can actually look and see if there's an effort going on in your community. If there isn't, and sign up to be a part of it. If there isn't one, sign up and put your town on the map, and we will reach back out to you and connect you with people who want to work locally in your community to pass a local resolution. So thank you so much.
Stephanie?
I would say that the fact that you're all on this call right now tells me that you still have hope even in the midst of all of the chaos and craziness and disheartening things that have happened over those past year. And so I applaud you for that. I imagine it's because you guys are on the ground. You are so close to our most vulnerable populations in this country, and so you're constantly reminded about why this is needed. And I hope that that's maintained for you. I hope that you'll be able to become strong advocates for this issue. And I just really can't emphasize enough. I mean, there's such a mass opposition to this, not just from industry, as Dr. Romano mentioned, but also from within our own Democratic Party. But the only reason why we've been able to maintain this momentum is through the grassroots movement, is through a coalition of doctors and nurses and people across the spectrum involved in healthcare. And so that movement is really powerful, and really it's our most powerful weapon against health reform, against blocking health reform in this country.
Thank you, Stephanie. Barbara?
And then finally, I would just emphasize that this is about values. It's about the healthcare system that we deserve as Americans, and it's about the healthcare system that we could and should have. And that's got to be rooted in the values that we want to see promoted through our public policy. So I would leave it there.
Thank you, panelists. Thank you, everyone, for being here. Let's go on and advocate for a single payer. We need this.
Thanks so much for including us.
Thank you.